Okay, in this class we are discussing about three topics. Okay, the first topic is classification of bone, the second topic is laws of ossification, and the last topic is bone marrow. Classification of bone and laws of ossification is already finished, so those two topics are going to be like a revision class. The one new topic is bone marrow. Okay, so what do you studied about classification of bone? Or what are the topics you have studied in bones chapter? Clavicle, okay. Long bones, okay. Fractures of bone. Cartilage, okay. Blood supply, okay. 6. Okay. First we'll start with the classification of bones, okay. So in classification of bone, under how many main headings you are going to study? What are the main headings for the classification of bone study? According to shape, okay. According to shape, okay. Developmental classification, structural classification, and any other classifications you remember? Say it louder, please. Okay, and another one is regional classification. Regional classification. Okay, these are the four main headings you should remember in the topic classifications of bone. We'll start from the regional classification. How many types are there in regional classification? Based on regions, how do we divide the bones or how do we classify the bones? It's your basic, yes. Axial skeleton and appendicular skeleton. Okay. Example for axial skeleton: skull, vertebral columns, thoracic cage. Okay. And appendicular skeleton is the bones of your upper limbs and lower limbs. Okay. Next, structural classification. How many types are there here? Long bone, okay. Short bone, spongy and compact bone, okay. Sesamoid bone, pneumatic bones, flat bones, okay. Any other answers from that side? Structurally, we divide it mainly into two categories. The first one is macroscopic and the second one is microscopic structure, okay. The first one is macro and the second one is micro, okay. Under the macroscopic study, we have two important types as your friend mentioned: compact bone and spongy bone, okay. So what are the examples for compact bone? Examples for compact bone: spongy bone. This topic is already discussed. I am informed only to give the revision, so you should answer. Or at least how do you identify the compact bone and spongy bone? What are the difference we can see in these two types of bones? Okay, compact bone is hard, whereas your spongy bone is porous in nature, or that's how the appearance will look, okay. What about the micro classification? What are the types of bone we can see here? In the micro classification, we can see lamellar bone, okay, oven bone, fibrous bone, and the last two are dentine and cement. Dentine and cement. These are the different types of bone we can study through your microscopic structures, okay. Next, what about the developmental classification? How many types are there? 3 types. What are those? Membranous, okay. Cartilaginous, membranocartilaginous. Okay. The first one is membranous. Example? Which one? Facial bones, okay. Can you name any particular bone? Maxilla, frontal bone and parietal bones. These are your membranous bones, okay. The second one is cartilaginous bone. Examples? Vertebral column, okay. Vertebral column. This side. What are the examples for cartilaginous bone? Thoracic cage, okay. Yes. Humerus and femur, okay. What is the next one? Membranocartilaginous bone. Membranocartilaginous bone. Examples? Which one? So your membranous bones are clavicle, okay. Mandible, your temporal and occipital bones. Temporal and occipital. These are the few examples for your membranocartilaginous bone. Do you know any other classification in development? There is one more classification that is named as somatic bones and visceral bones. The fourth one is somatic bones, okay, and the another one is visceral bones. Visceral bones. Most of the bones present in our body are somatic bones. For visceral bone, you can mention hyoid bone. Hyoid bone, and another one example is ear ossicles. Okay, remember this, somatic bones. Most of the bones present in our body are somatic bones only, and another one is visceral bone. Example for visceral bone is hyoid bone and ear ossicles. Where we can see the hyoid bone? In this region, sure. Sure? Okay, fine. So, any doubts in this? Hyoid bone and ear ossicles. Ear ossicles bones. The last one is according. Say it again. Compact and spongy bone. What are the examples for compact and spongy bones? Visceral bones. Somatic bones and visceral bones. So, for this one, compact and spongy bones, is that not discussed in details before? No. So, what you know about compact and spongy bone, tell me that first. She mentioned compact is like hard structure, whereas your spongy bone is porous in nature. Okay. So, okay. So, you can give your long bone as example for your compact and spongy bone also. So, if you see the structure of long bone, see this is like long bone, right? This part what you are seeing, no? This will be the compact zone or compact part. Okay, and in this area you can see the spongy bone area, spongy part. Okay, this is how your compact and spongy structures are present. There is, I'll add the picture when I give the PPT, you can check it in that, and in dissection class I am going to discuss this one in detail. Okay, so when you are writing example for compact and spongy bone, write your long bone as example, draw a diagram and show this is the compact part and this is the spongy part, like this. Okay, so according to shape, how many types are there? 3 types. Okay, what are those? Long bone, short bones, flat bones, long bone, short bone, long short bone, okay, flat bones. I'll write your irregular bone, okay, and the another one is sesamoid bone, pneumatic bones, and accessory bones, also under the according to shape classification, accessory. Okay, so in your textbook all these 7 types of bones are given under the main heading according to shape. Try to remember all the 7 names, it will be your viva question for sure, and you should know examples for each type of bone. So example for long bone, femur, okay, short bone, clavicle, carpal bones, okay. Okay, next flat bones. What are the example for flat bones? Ribs, okay. Next irregular bones. Sphenoid bone, okay. Where you can find the sphenoid bone? In the skull, in this area, sure. Okay, fine. Right now just know the names, more than enough. And the next one is sesamoid bone. What do you mean by sesamoid bone? What is the definition for sesamoid bone? You should know the definition for sesamoid bone, pneumatic bones and also for accessory bones. For these 3 bones, you should know the basic definition and also the examples. Please repeat it once again so that your friends can also listen. Did you heard her? Try to come on time, okay?
Sesamoid bones are bones that ossify after birth and are found in tendons or joint capsules.
Okay. What is the example for sesamoid bone? Patella? Kneecap, that is patella. Okay. Anybody know the definition for pneumatic bones? Bones that are present with air cavities. Where we can see such bones? In birds. Can we see any pneumatic bones in human? Yes. Which bone? Axilla. Maxilla. Okay, fine. Next, accessory bones. What is the definition for accessory bones? I think this topic is finished in very first week only, classification of bones. At least example for accessory bones? Coccyx, okay. Any other bones? Okay, by next class know the definition for accessory bone and also 1 or 2 examples. Is it clear for everyone, classification of bones? Next topic is laws of ossification. What do you mean by ossification? Please use the mic and answer. What do you mean by ossification? How the ossification process takes place? That topic is also finished again. It's not a new topic. So what do you mean by ossification? It is a process. Ossification is a process where the formation of bones takes place. Okay. So how many types of ossifications you know? Do you know any types in ossification? Tell me whether ossification is finished or not. They said ossification is finished, so you just give revision class for laws of ossification. Okay. For the process of ossification, your bone will follow around 5 to 6 laws. Okay. In few sources they have mentioned about only 5 laws. In few sources they have mentioned about 6 laws. So we are going to discuss about all the 6 laws. Okay. We'll take an example of your long bone. So can you name the parts? What is this part? Epiphysis. So this is also epiphysis. What about this part? Diaphysis. Do you know any other parts to name? Metaphysis. Where metaphysis will come? Here. Okay. Okay. Here your metaphysis will come. Any other parts? Epiphyseal plate. Where we can see the epiphyseal plate? Shall I write it here? Is it right? Okay. This is your epiphyseal plate. Okay. So for the very first step, your ossification should be done in a few particular centers. Those centers we name it as primary ossification center and secondary ossification center. So the rule number 1 is the primary ossification center is always present in your diaphysis area, whereas the secondary ossification center is present in the epiphysis area. So this is your primary ossification center. Okay, and this is your secondary ossification center. This is the very first law. Primary ossification center is present in the diaphysis, whereas the secondary ossification center is present in the epiphysis region or area. The second law says that primary ossification center is always 1 in number, okay, and your secondary ossification center is either 1 or more than 1 in number. Okay, this is the second law. What about the third law? Your primary ossification center is present before the birth, and your secondary ossification center present after the birth. These are the first 3 laws of ossification. Can anyone repeat please? So what is the first law says? Primary ossification center is present in diaphysis. Secondary ossification center is always present in epiphysis. The second law says primary ossification center is 1 in number and secondary ossification is it's either 1 or more in number. The third law says the primary ossification center always present before the birth and the secondary ossification center is present after the birth or can be seen after the birth. Okay, but there are few exceptions. Okay, For the second law, the accepted or the exception bone is clavicle. Your clavicle have how many primary centers? It has 2 primary ossification centers. Okay, this is the exception for second law. What about third law? What are the exceptions for third law? The one point to remember is last minute. Last minute. This is the abbreviation to remember. Okay. L stands for lateral cuneiform. M stands for medial cuneiform. I stands for intermediate cuneiform. Intermediate cuneiform, and N stands for navicular bone. In these 4 bones, your primary ossification center can be seen after the birth. Primary ossification center is seen after the birth. Okay, the number goes from 1 to 4. Lateral cuneiform can be seen in first year, medial cuneiform can be seen in second year, intermediate cuneiform can be seen in third year, and your navicular bone can be seen in fourth year. So the number goes in the same order, 1 to 4. Okay. What about the secondary ossification center exception? It is the lower end of femur. Lower end of femur. Your lower end of femur, or in the lower end of femur, we can see the secondary ossification center before the birth or at the time of birth. Okay, here we can see secondary ossification center at the time of birth or before the birth, that is in 8th or 9th month of the intrauterine life. Okay, these are the exceptions. Okay. Now the fourth law, I have mentioned there are more than one ossification center, like secondary ossification centers, right? So now imagine this is the very first one to appear. First one to appear. So after this secondary ossification center, the others will appear. So what happens is, except this one, all these ossification centers will fuse together and combine with your epiphyseal plate first. Okay, the one which appear first is going to combine at the last. Understood? Understood or not? The first secondary ossification center which appear is going to fuse with your diaphysis or with your epiphyseal plate at the last. This is the fourth ossification law. The fifth ossification law is your nutrient foramen is always present away from the growing end. When you are studying about osteology, you observe for the nutrient foramen, it is always present away from your growing end of that particular bone. Okay, there is again one exception in that is your fibula. Okay, so take down the assignment question. Why or how fibula violates the law of ossification? Why and how fibula violates the law of ossification? Violates the law of ossification. Okay. So the last, that is the sixth law, is all the secondary ossification centers combine first and form the part of bone, then it will combine with your diaphysis region. Okay. All the secondary ossification centers combine to form a epiphysis region first, then it will combine with your or fuses with your diaphysis region. Understood? So this is all your 6 laws of ossification. To understand this in detail, you should know about ossification first. That class is finished, but not sure why you guys are not answering. Please go and see that ossification part once. After reading the basic definition and knowing about the ossification process and types of ossification, just go through this. You will get to know detail. Okay. Next topic is bone marrow. What do you mean by bone marrow? And these exceptions are MCQ question. Note it down, okay? Exceptions are MCQ questions. What do you mean by bone marrow? Where you can see the bone marrow? Medullary cavity of long bone. Any other example? First tell me what is bone marrow. Any basic definition or anything you know about bone marrow? Formation of RBCs, okay? And how many types of bone marrows we study? 2 types, very good. What are those? Red bone marrow, yellow bone marrow, okay, fine. Then most of you know the basic things. So I'll start with the definition. Your bone marrow is a soft, okay, loose vascular tissue which contain network of reticular fibers. Okay, remember this definition. Bone marrow, I'll repeat, bone marrow is a soft, loose vascular tissue which contain network of reticular fibers. Okay. Your bone marrow make up to 4 or 5% of body weight in a healthy human adult. Okay, your bone marrow make up to 4 or 5% of body weight in a healthy adult human. Okay, bone marrow can majorly seen in the medullary cavity of long bone, and also in the cavities of your spongy bones and cavities of spongy bone. We have 2 types, that is red bone marrow and yellow bone marrow. So what is the difference between red bone marrow and yellow bone marrow is a 3-mark question, important question. Difference between red bone marrow and yellow bone marrow. What is the difference between red and yellow bone marrow? Difference between red and yellow bone marrow. Yellow bone marrow appears yellow fat deposition because of the fat deposition. Okay, what about this one then? Red bone marrow. Why it is given the name red? Erythropoiesis takes place in the red bone marrow part. What do you mean by erythropoiesis? Formation of red blood cells. Okay, fine. In your red bone marrow and yellow bone marrow, you should mention about the stem cells name, where it is present. These are the 2 important points. The stem cells present in your red bone marrow are homopoietic or hemopoietic stem cells. And the stem cells present in your yellow bone marrow are mesenchymal stem cells. Okay, we have Hemopoietic stem cells and mesenchymal stem cells. These mesenchymal stem cells will later develop into a fat part and give protection to your yellow bone marrow or act as a storage part. Okay. These hemopoietic stem cells are also called as blood forming stem cells. Blood forming stem cells. Okay. This will differentiate into your RCB, RBC, WBC and platelets. Okay. Your hemopoietic stem cells will later differentiate to form the RBC, WBC and platelet cells. Okay. This one can majorly seen in the cavities of spongy bone. Your red blood cells is present in cavities of spongy bone. Okay. Whereas your yellow bone marrow is present in the medullary cavity of long bones. Medullary cavity of long bone. At the time of birth or on the initial days, your red blood cells are present in red bone marrow is present all over the body part. Okay. As the person growth takes place, it will get converted into yellow bone marrow. Your red bone marrow will get converted into yellow bone marrow. This is one important point. So at the adult stage, in which part we can see the red bone marrow? Understood the question? I said in the initial days your red bone marrow is present all over the human body. Later as the person get age, it will convert into your yellow bone marrow. So once the development takes place, in which part we can see the red bone marrow? It is given in your textbook along with the diagram. Spinal. Okay, spinal cord area. Can I say like that? Okay, in the spinal cord area. Any other examples? Thymus. Okay, which one? No, I'm asking like red bone marrow or yellow bone marrow. Which one you are telling? Red. Okay. He is telling thymus and your friend said spinal cord area or region. Any other answers? It is given in your textbook along with the diagram. So everybody, epiphysis of long bone. Okay. Red bone marrow. Okay. Red bone marrow can also be seen in the epiphysis of long bone. Any other answers? Sternum, okay. Ribs, okay. Sternum, ribs, the thoracic cage area, fine. Okay, everyone just open your textbook and see the diagram and content of bone marrow once.
Medullary cavity is filled with red or yellow bone marrow. At birth, the marrow is spread everywhere with widespread active hemopoiesis. As the age advances, the red marrow at many places atrophies and is replaced by yellow, fatty marrow with no power of hemopoiesis. Red marrow persists in the cancellous ends of long bones. In the sternum, ribs, iliac, crest, vertebrae, and skull bones, the red marrow is found throughout the body. In the sternum ribs, iliac, crest, vertebrae, and skull bones, the red marrow is found throughout life.
So where we can form the red bone marrow? It's in the sternum, okay, iliac crest or iliac crest and vertebral column and also in your skull bone. These are the four major areas we can see the red bone marrow in adults. Okay, the other parts are filled with your white bone marrows. Okay, so this is all about your bone marrow. Any doubts?